Can you imagine having a genetic disorder that not only affects your physical appearance but also alters your internal makeup? Have you ever heard of Turner syndrome? Turner syndrome is a genetic defect that affects females only and causes them to be deficient in, or in other words, lack one X chromosome, whereas the normal person inherits two X chromosomes from their parents. This genetic abnormality affects 1 in every 1,500 to 2,000 females at birth. Although I do not know anybody or have met anybody with Turner syndrome, I'm sure some of you may be familiar with the actress Lisa Hunt. Lisa Hunt is a highly achieved Oscar award-winning actress who lives with Turner syndrome. And some of the symptoms that girls will experience with Turner syndrome include learning disabilities, heart defects, delayed puberty, abnormal development of their reproductive organs, and infertility. Physical appearance-wise, some girls will experience short height. They will be shorter than the usual average height of women, and they will also have a shortened neck, making it seem like they almost do not have a neck at all. Lisa Hunt has these two traits. She's very short and has no neck. And in 2011, a case was done at Stanford University with 4 doctors, David Hong, Alan Reese, Bria Duncan, and Sting Bray. And the purpose of this study was to figure out how Turner syndrome affects the cognitive process, which in other words is just how somebody learns, and the memory of individuals with Turner syndrome. They were also curious as to why there was such a large difference between the verbal performance capability and the IQ capability of individuals with Turner syndrome, meaning that girls with Turner syndrome were able to speak well and coherently, but when it came to memorization and things including logic and intellectual stuff like that, they were a little bit slower and had a harder time with it. In this study, the 4 doctors, Hong, Allen, Duncan, and Reese, took a handful of participants ranging from ages 7 to 13 years of age, both girls with Turner syndrome and without Turner syndrome. And with this age group and range of girls, they were able to compare where their brain was at different age levels and different stages in life, and then compare it to those age levels and stages in life of the girls without Turner syndrome. So in this study, the doctors found out that the participants and girls with Turner syndrome had a significantly reduced activity in the frontal and parietal lobes of the brain, which is here and here, affecting their hearing and processing. But they also found out that as they went on and as they were testing these girls, the memory of the girls was increasing, and also that the memorization from adolescent and adulthood was significant, meaning that as the girls went on, they had better ideas and learning capabilities. In this test, the doctors conducted various MRIs, various speaking tests, learning tests, memorization tests, and this helped them conclude all of their facts. So in conclusion, what we found out from this study was that Turner syndrome affects the memory and almost puts a hold in it, and also with learning. And we also found out that it can be worked on, as in it's not a for sure like stump in their growth, and if they work hard and practice, they can eventually achieve a normal like speed and intellectual capability. Turner syndrome, again, is a genetic disorder that's only found in females and causes them to lack one X chromosome.